and welcome to Hatching for Health, where our mission is to give people a platform to tell their story, to educate the public, and to build a more compassionate community. And I'm your host, Jessica Hatch. Today, we are going to be talking with Heather and her daughter, Kayley, that are joining us. And Kayley was diagnosed with a rare neurological mutation known as ARX-related epileptic encephalopathy, and I probably didn't pronounce that perfectly, but we'll get the mother too. And also, Kayley was born with this mutation, and it didn't show up symptoms until she was 4 months old. And when Kayley had her first seizure, that's when they knew something was wrong. Through Kayley's journey, Heather has found community in the national organization Ainsley's Angels, and we'll be getting more detail about that in her mission shortly. And the second half of the episode, we will be joined by Dr. Remy Nader, who's going to answer some questions about ARX-related epileptic encephalopathy. And Dr. Nader is a neurosurgeon here in Texas, and he treats degenerative, traumatic, and neurological diseases. I told you that was a mouthful.
Yes,
a lot. It's so good to have you guys.
Thank you, Jessica, for having us on your show.
Yeah, thank you for coming out and making this trip over. I know y'all are local Houstonians, but still, I know it's still a lot in this Houston traffic and heat. So I wanted us to kind of start out with kind of learning the journey from like when you were even pregnant, and did you know at that point that there was something wrong with your daughter?
Yes. So this was my first pregnancy, and Kayley's my first child, and my pregnancy was absolutely normal, other than, of course, I had morning sickness all the time.
Yeah.
That seemed to last the entire pregnancy.
Okay.
But my delivery was normal. I was full term. There was no indications or anything from my pregnancy that there would be anything wrong with Kayley. Okay.
And so, do you personally have any medical background?
I have very little medical background, enough to understand, what basic illnesses are, but that's really about it.
Right, okay. So ultimately, when she was born, because I know I kind of spoke already about the fact that it wasn't until 4 months, so was there anything along those first 4 months of her that was like an obvious sign that like something's not normal, or was there nothing?
So the first 4 months of her life, as best as I could tell, for being a first-time mom, there was no indication or anything that was anything wrong with her. Like it seemed like she was developing normal. Mm-hmm. But when she became 4 months old, it was on my 30th birthday, I noticed that she began making these very unusual movements with her head and then her stare, and she would stare off to the side, and she would almost be like a tremor. Okay. And that is what got me like worried, thinking, okay, something is not right. My instinct felt that something was, I needed to get her looked at, and so I took her to Texas Children's Hospital.
Okay, okay. And right now, I know you talked about when she gets excited, she kind of, jumps around and stuff, right?
Yes, I think she's very intrigued in what are we doing here today, and seeing all the lights. And
Of course. So tell me, what kind of therapies, like, once the diagnosis was given, like, what are the therapies that they told you, like, how this can be treated and what you can do?
Yeah, so this was really challenging because when she was 4 months old and they found the diagnosis, and they didn't even understand her diagnosis until she was 8 years old.
Really?
Because of a test that became available at that time called the whole genome exome sequencing test.
Okay.
And that test was what basically revealed to us that the first 8 years of her life, when all we were informed was that she basically had a global developmental delay. She wasn't meeting the milestones, those markers of when you would go into the pediatrician's office and they hand you this form, and is she holding her head up? Is she doing? And Kayley wasn't doing any of those things.
Okay.
So they recommended the therapies, and we got involved with what's called ECI, Early Childhood Intervention.
Okay.
And they sent different therapists out to our home, and they evaluated her and decided, these are the types of therapies that we need to start doing for Kayley, because we don't know long term what her development is going to be.
Okay.
So physically, we had a physical therapist, we had occupational therapy, we had vision therapy.
And at this point, the diagnosis that I know I probably didn't pronounce perfectly, but ARX-related epileptic encephalopathy, is that at this point you knew that was a diagnosis, actually all the way at 4 months, but you just didn't know like what it was gonna?
Well, first she was diagnosed with something called infantile spasm syndrome,
Okay.
which was what happened when she was 4 months old. That was what the seizures that she was having.
Okay.
Then, when she was 8 years old, we did this genetic testing.
All the way 8 years.
Yes.
That's so long.
That's when the test became available.
Yeah.
And this was like a $20,000 test.
I think the family I just had on did the exact same test.
Yes.
And they did it several years
Yes.
after because, well, it wasn't available, like you said.
Yes.
So like you would have done it maybe sooner. I mean,
Yes,
But-
and it wasn't available plus.
is it 20,000 out of pocket or is it insurance?
So we had to fight to get the insurance to cover it.
Wow.
And this is like what is so hard as a parent is
Yeah.
understanding and knowing all of these things that we need for our children and these tests and that, so we can give them the
course.
treatment that they need and
Of
the
course,
therapies
yeah.
that they need based off of what their diagnosis are.
Mm-hmm.
And so when she was 8 years old, they said, okay, we found out it's ARX related epileptic encephalopathy. And so what basically that meant is while I was pregnant, one little gene basically got out of sequence and basically got skipped. But that one gene is responsible for developing the protein in her brain.
Which one is it? Which?
It's the ARX gene and it's on the X chromosome.
Okay. Is it like 1, 2, 3, 4? Like, is it 8? 2, or 3?
You know, that's a great,
Okay.
When they tell you all these things, first of all,
It's like foreign.
your
You're
firstborn
like,
child, you're trying to understand,
yeah.
what am I going to do? How am I going to care for her? You know, if you work a full-time job already, and someone needs to
Right.
be at home all the time,
Yeah.
all these therapies,
Yeah.
balancing all of that and juggling all of that, it's very, very demanding as a parent, but nobody is giving you a book that says, okay, here's all the tests you need to do. Here's all the therapies you should get involved with. It's
Of
very
course.
hard.
It's
and
like
that is,
navigating, a maze that,
yes.
that someone else has never been on that because
Yes.
it's something that. So do you know how many people have been diagnosed with this condition in the U.S. by chance?
That is a great question. So when we went through the genetic testing, the genetic counseling that we had after we found out this was a genetic mutation, they gave us very little information because
Okay.
it is not a very well-known genetic disease mutation. They did tell me this. They said that this ARX gene, this mutation does commonly occur in males, but not females. So Kayley was a very rare
Wow.
case. In fact, we have not met another female that has this ARX condition. The first girl we met was in Scotland, and it was through a Facebook group that we
Wow.
found. I just started Googling ARX,
Right.
and I found a Facebook group, and I joined it, and then there was I sent a picture of Kayley and
Yeah.
posted a picture and all of like the things that she does and the
Right.
stimming and this mom responded over in Scotland and said, "Oh my gosh, your daughter looks just like, it reminds me exactly of my daughter."
Her daughter. Wow. And so you immediately had a connection there which I feel like those kind of moments, like they do so much,
Yes,
for you as a
yes.
mother, and like somebody else is going through exactly what I'm going through versus there's so many things people think are hard and it's, nowhere near,
Yeah.
what you're having to do. So I know there's an organization, Ainsley's Angels. Okay, so tell me about that because it seems like it's been very impactful for you and your family.
Yes, in fact, we are wearing Ainsley's Angels colors today, our
Okay.
pink is our color, so thank you for wearing pink.
I love that. Yeah, that makes sense. You've got the pink and the logo, everything.
Yes,
That's y'all's
so-
logo here, yeah.
So Ainsley's Angels is an incredible nonprofit organization that right now is participating in over 40 locations across the United States. And
Wow.
that's from the East Coast to the West Coast. And it has been life-changing for our family, not just for Kayley, but for our entire family. And what we do is primarily we advocate for individuals with disabilities, and we are going out into the community and basically trying to create opportunities
Okay.
for our loved ones with disabilities to participate primarily in endurance sports.
Okay.
So everything, yes, so everything from 5Ks to ultra marathons.
Okay.
Kayley has been in the Houston Marathon 3 times.
Wow.
We've traveled to Washington, D.C. and participated in the Marine Corps Marathon last year.
So when you say this means that you're participating and you're behind her wheelchair, right?
Well,
Kinda taking her-
I cannot take the glory for that.
Yeah.
I tried it. I have participated with her in a few races.
Okay.
But the beautiful thing about this organization is that we have so many volunteers that want the opportunity to come and meet our children and push them in these races. And it's not even just about the race. You know, these opportunities that we're trying to create are everything from adaptive roller skating. We also provide like resource training to parents, and you know, we're going to do a CPR training that we offer to our families. It's really about engaging the community as well, like getting the community to open up their businesses, their recreational things to individuals with disabilities, so they can be a part of the community and participate alongside their peers.
Of course, and so it's not inclusive of just any particular conditions. It's, you know, everybody that has any type of health condition, genetic, rare, not so rare, is basically joins forces as part of Ainsley's Angels.
Yes, ma'am. So any individual with a disability that would be unable to participate in one of these events that we attend, they are welcome. We welcome so many different individuals with diagnosis, and you also, what also is great about this, there's no age limit. So we have, you know, as young as 5. Our oldest, we call them our angels. Our oldest angel was 80 years old, and she just passed away from Alzheimer's.
Oh, wow.
But she was a marathon. She had been in marathons, and these experiences are things that, as a mom, I never thought I would see my child crossing a finish line. And getting them off the sidelines and getting them into the race and letting them cross that finish line. As a parent, like seeing that it's overwhelming, and you're just so appreciative for any chance you
that opportunity, to be able to compete in something, you know, especially like, you know, the non-vocal part, like there's just so many things that like I'm sure she wants to say and communicate, but being able to put that, you know, passion into like some type of athletic option is, I think that's beautiful. So they're very focused on the, like you said, kind of the competitive stuff, like you were saying, the rollerblading or the you know, running or being, you know, basically pushed to compete, right?
Yes, like so at triathlons, we do triathlons. We also just recently started doing the Spartan Challenge, which Kayley has done 2 years in a row. Kayley, tell Miss Jessica. Kayley did
the Spartan
Challenge, which is obstacle course. And there were about eight volunteers assigned to each of our angels, and that helped to maneuver them through all these obstacles.
Really? Like they'll get her out of the wheelchair and do all of the things?
Yes, we had harnesses on them. We would pull them on like a tarp with ropes to get them underneath the barbed wire.
How amazing.
And really, Jessica, this is, Ainsley's Angels it's really been personally, like for Kayley, therapeutic for her.
I bet,
because she has this oral, she's got sensory processing disorder. And what that is it basically, she's just very like, she's stimming kind of all the time to where she needs some kind of sensory input. So the motion, when she's rolling in these, what we call racing chairs,
it's really good for her.
It's very calming to her.
I bet, So how can families join Ainsley's Angels?
We really love our families. We welcome all of our families, and it's so easy to do. All they need to do is go to www.ainsleysangels.org, and they would choose on there if they would like to be an angel, what we call rider. That's our angel athletes. Or a pusher, or also we have volunteers. We are in great need of volunteers of all types of volunteers. You don't need to just be an athlete, Jessica.
You
don't just need to be able to run a marathon. Like, we have needs for people selling merchandise. Our fundraising team, like there's all sorts of.
Amazing. So they'll go to the website, and then there's an email that they can be connected with somebody that'll get in touch with them, and then, you know, basically be able to join.
They'll join, and I'll get the email once they sign up to be a part of the Greater Houston Ambassadorship. And then they'll get an email from me welcoming them to our Greater Houston Ambassadorship. And then on our Ainsley's Angels website, they can look at the calendar of events.
And find out all about it. I love that. We'll have to get more detail from you as well. We have to take a commercial break. But when we come back, we are going to be joined by Dr. Remy Nader via Zoom. And we're going to get some answers from him and a little more expert opinion on this condition. So we'll be right back with you. Welcome to Arabella Chiropractic. We are located right here in the heart of Houston, right down the street from Lakewood Church off 59 in Edlow. We welcome you to come visit us for any of your chiropractic or physical therapy needs. We have a licensed massage therapist on board, as well as a tech that's trained to do our ultrasound and stim with hot packs. We also offer physical therapy and, of course, the chiropractic visits where you can get adjusted and discuss any of those aches and pains to see how we can better help you feel better. Here at Arabella Chiropractic, we want your experience to be amazing. So come see us here at Arabella Chiropractic, where you can discover wellness through chiropractic excellence.
Your private practice deserves more than sticky notes and missed calls. Funnel Cake MD is the HIPAA-compliant growth platform built for doctors and dentists. Manage calls, texts, and emails in one secure inbox. Book more patients, cut the admin chaos, and keep your front desk sane. Try it free for 14 days with full white glove onboarding so you're running smooth from day one. Don't let outdated software hold you back. Sweeten your growth with Funnel Cake MD. Start your free trial now at funnelcakemd.ai.
Funnel Cake MD, all-in-one tool to grow your practice.
Welcome back from the break. If you are just now joining us, we have on set currently Heather and her daughter Kayley, and we were talking about a rare condition her daughter was diagnosed with, known as ARX-related epileptic encephalopathy. And we are now joined by Dr. Remy Nader calling in, and he is going to actually talk to us a little bit, give us some expert opinion about this condition. So thank you for joining us, Dr. Nader.
Thank you, Jessica. It's great to be here today and to be able to talk about this condition.
So I wanted to kind of get right to one of the things that I felt was very unique. So these ACTH injections that are something that Kayley's been doing. Can you tell us a little bit more about that particular injection and how it benefits her?
Yes, absolutely. So ACTH stands for adrenocorticotropic hormone, which basically is a hormone that's produced by the brain that regulates your level of cortisone in your body. And by regulating the amount and the level of cortisone, it modulates it. And this way it can cause you to release more of that hormone. So the reason why this helps with her condition is because the more you release this hormone, the less inflammation you're going to have in the body. It has an anti-inflammatory effect. And it also suppresses the excitation in her brain. It causes suppression of what's called the excitatory neuropeptides in the brain. And by that same token, it will reduce the frequency and the severity of the seizures that she's experiencing.
Oh, wow. So actually, how often does she have those done?
So Kayley's very excited right now, by the way, Jessica.
I know.
She's hearing Dr. Nader talk and she's very excited. So Kayley has seizures probably about 5 a month, and her seizures only happen at nighttime.
Okay, and that's what the shots basically is.
So she's not on the shots anymore. She was on that treatment when she was first diagnosed with infantile spasm syndrome.
Okay.
And she was on that treatment for about 6 weeks, I want to say.
Okay.
And that treatment is what stopped the spasms.
Oh.
And so now she's on several seizure medications, though, that help to control the seizures that occur at nighttime.
Okay. I'm going to ask one more question, but then I want you to ask any questions. But, so, Dr. Nader, are you able to give us some more details about the benefit from the whole genome sequencing test that they did?
Yes, absolutely. So ARX, epileptic encephalopathy, is related to a specific mutation to the ARX gene, which is essentially, it's a gene on the X chromosome that's used to produce some protein that's involved in essentially modulating and creating these connections in the brain, what's called the interneuron connections. So because it's related to a specific gene, it can be passed on from generation to generation. So it's useful to do genetic testing to see, number one, which parent is the carrier, where is this gene coming from? Is it coming from the mom or the dad, basically? And also, it's useful to know, which particular place on that gene or on that chromosome is the sequence located. And also, it helps for future parent planning. Like if the parents are planning to have another kid or another child, it's useful for them to know, hey, what are the chances, what are the odds of that child having that same mutation? And also, if they have siblings, brothers and sisters that are planning to have children themselves, they should get tested as well. Obviously, on the side of the parent who has the mutation.
So Heather, I wanted to see what questions you had for Dr. Nader.
Yes, Dr. Nader, I don't know a lot still. You would think I would, but there's not a lot of research, I feel like, still on this ARX gene. I'm just really curious. Kayley's seizures happen always at nighttime. And I'm just really intrigued by that. Like, what causes that? Like, do you know what causes why her seizures only occur at nighttime?
Yes, so there's actually a reason for the seizures to primarily happen at nighttime, if you will. Especially in her type of condition. So what happens is that during sleep, when a child is asleep, it actually lowers your seizure threshold. There are certain sleep cycles, what's called the non-REM sleep, where basically your brain becomes disinhibited, if you will, and you're more likely to have some aberrant firing and activity in your brain that can cause seizures, essentially. Uh, Specifically with this, given the role of the ARX gene, so that ARX mutation leads to the loss of what's called the interneurons that have GABA or GABAergic function. So that specific function suppresses brain activity. So if on top of the fact that you're lowering your seizure threshold at night, you don't have these neurons that suppress brain activity, well, it creates sort of the perfect environment in the brain for those seizures to come on. Okay. Um, So, and also there's something about the circadian rhythms in your body that have an effect on the hormones, on the hormone balance in your body. So during those low cycles of the circadian rhythms, certain hormones are less secreted, and again, that stimulates or that's a better environment for seizure activities to take place, if you will.
Thank you.
Yeah, so
That's interesting.
I know it is interesting. It's like you think the opposite, like it's calming. You're all calmed down. You're sleeping, and then, to have that kind of circumstance throughout the night. Is there like I mean, I know you take probably quite a few medications. Is there a medication, Dr. Nader, or anything that I guess kind of could help prevent those being at night, considering that's usually when mom and dad aren't right there?
So, I mean, I would say there are some techniques or methods that can be utilized to suppress the seizures in general, I would say. Whether or not it suppresses them more at night than during the day, it's hard to tell. So it's sort of a trial and error thing that you have to do. Obviously the ACTH treatments, the ACTH injections that we have discussed earlier, certain steroids can also help, like prednisolone treatments. There's certain seizure-specific medications like vigabartin, for example, that has been developed specifically for those kinds of seizures to suppress them. And also, I would say last but not least is the ketogenic diet. So reducing the amount of sugar that you consume, again, that reduces the excitation in your brain. And as a consequence, reduces the frequency and the severity of those seizures. So, going for a ketogenic diet in the long term is going to help her quite a bit, I believe.
I have heard about that ketogenic diet. That's interesting.
Yeah, I would definitely, recommend it if it's coming from him. I was gonna say, okay, so is there any way to detect this ARX in utero? Because I know there's so many now opportunities for surgeries to take place, in utero. Is this something that can be diagnosed, or is that almost impossible?
Actually, it is quite feasible to detect it in utero. You can do some sampling, some amniotic fluid or chorionic villus sampling, what we call, where basically they go in with a very fine needle and just get small amounts of fluid or of tissue from the placental area, and you can run genetic testing on it and detect the mutation, basically. And in fact, that's part of the planning process. Well, first of all, it gives you a diagnosis much earlier, even than the baby being born. And then you can prepare for it, basically plan for it and so forth. So if you expect that to be the case.
Okay. Well, I know you're in a busy practice over there, but I really appreciate you coming on and being able to visit with us. And I'll connect Mom with you if there's anything further she wants to maybe educate herself on. But thank you so much for joining us, Dr. Nader. I really appreciate it.
Thank you, Dr. Nader.
Absolutely. Thank you so much for having me on, Jessica, and good luck to you. Thank you.
Thank you. I did want to, because we have to wrap up, I wanted to ask you, what's the next event that Ainsley's Angels is putting on that we could be involved in or others could learn about?
Absolutely. I'm so excited, Jessica, because Ainsley's Angels, another thing we do is we put on ourselves 10 races throughout the country every year. One of those races happens to occur right here in our greater Houston community. It's called the Ainsley's Angels Twilight 5K, and we welcome everyone, all individuals with disabilities to this race.
Okay.
It's the evening of October 4th. It's a night race at 6 p.m. And you can find out about that race by going to Ainsley'sAngels.org, and there's the top right, there will be a race series that you'll just click right on, and then you can find the race Twilight 5K, and it is absolutely free for any individual with a disability.
Wonderful.
Any of the events that we put on are absolutely free for any individual with a disability.
Well, wonderful. Well, thank you so much for being here, Heather and Miss Kayley. It was a joy. And thank you all for tuning in to another episode of Hatching for Health. We'll be right back here with you next Saturday.